Vaccination is a hugely successful prevention tool that saves millions of lives every year. COVID-19 has shown that vaccines are a key pillar of public health, but the pandemic has also exposed the vulnerabilities of our healthcare systems. More work is needed to strengthen them so that they can respond to upcoming healthcare challenges. Sibilia Quilici, Executive Director of Vaccines Europe at FPA, takes a closer look into how healthcare systems can become more resilient.
The pandemic put the need to vaccinate the adult population at the forefront of the response to a major global public health crisis. And this was not without difficulties, notably with regards to convenience in access to the COVID-19 vaccines, complacency towards the severity of the infection, and confidence in the new vaccines and the decisions made by our policymakers. When we look at the pediatric immunization programs, for instance, they are well established across the Union, but we don't have the same level of readiness for adult immunization. Also, it is important to consider that Europe's population is aging, and the climate change is expected to bring major changes to the epidemiology of infectious diseases and greater need to immunize adults. And this is why adult vaccines for multiple infectious diseases are currently being developed. So all of this means that we need to build robust immunization schedules and infrastructure for adults as we have for children.
Countries should have the funding, infrastructure, and capabilities to deliver vaccination programs for their citizens at all stages of life. The issue lies in the way immunization programs are supported, politically and financially. Almost 80% of European governments spend less than 0.5% of their healthcare budgets on immunization programs. This leaves countries vulnerable to vaccine-preventable diseases. What are the solutions to help healthcare systems become more resilient?
First, I think we need to acknowledge that vaccination, being a key barrier to external threats such as infections, is essential to support our healthcare system's resilience. But successful vaccination requires dedicated and sustainable financing, and today governments spend less than €5 per capita on their immunization program. We can protect people routinely throughout their lives against up to 20 vaccines-preventable diseases today, and possibly more tomorrow. This needs to be reflected in the budget dedicated to immunization in each EU member state to ensure that immunization programs protect people at all stages of life, that the right infrastructure is put in place to support trained and informed healthcare professionals, that convenience access to existing and new vaccination is provided, and electronic records and reminders are put in place.
Professor Paolo Bonanni explains how Italy has evolved its national immunization program to where it is today and how this shift has prepared Italy for the future.
Before 2010, different scientific societies in Italy proposed ideal calendars for vaccination, but since 2012 we created an alliance among the Italian Society of Pediatrics, the Italian Federation of Family Pediatricians, the Italian Federation of General Practitioners, and the Italian Society of Hygiene and Public Health. This alliance brought to the creation of the first vaccination calendar for life. This proposal became the basis to have a national vaccination plan, which included a very high level of offer for all vaccination throughout life. In Italy, we have always put an emphasis on prevention and also on vaccination programs. By investing in prevention, we are better prepared to future challenges for health. It is really important that national immunization programs are well funded and inserted into the health system, including adult immunization. It should be stressed that health authorities in all countries should perform an horizon scanning to look at the possible new vaccines coming to the market in the near future to expand vaccination protection in their population with a life course approach. So not only concentrating on children, but also on adolescents, on pregnant women, and on the elderly population. I would also say that we shouldn't not only invest in introducing new vaccines, but also invest in making coverage higher. And so we should consider all the possibilities to implement vaccination programs so that the coverage is high and the protection is offered to the entire population.
Strong national immunization programs for adults as well as for children are key to increasing coverage rates for routine vaccinations across the life course in all European countries. We need to work together today so that we can address the health challenges of tomorrow.